Hi, my name is Allison Parker, and I will be talking about my internship at the Baptist ER Collierville. This is my internship with COVID-19. Daily operations changed pretty frequently in the ER because you never knew what you were going to walk into. You never knew what kind of patient was going to come in or what they were going to need. There were a few things that were mandatory for us to do at the start of our shift. That would be to stock and clean the patients' rooms. We had to make sure they were wiped down from ceiling to floor. We had to make sure that all the materials were in there that needed to be in there. You had a specific number for each set of things, and you had to go through everything in the room that had an expiration date on it and make sure all the expired materials were out. We had to make sure the blanket warmer was full because the blanket warmer was actually a very important part of the ER. It's very cold. You get a lot of elderly people in there, and they need 2 or 3 blankets at a time, so you go through them pretty fast. You had to make sure that you could round with the doctor as much as possible. This gave you the ability to get as much experience as you could working hands-on with patients and knowing how to speak with them and how to assess them. We wanted to be as hands-on as possible to make sure we were really getting out of our internship what needed to be getting out of. When the coronavirus first hit at the hospital, they didn't seem really worried about it. They kind of acted like it was just a joke and that they were ready for it to be over with. They thought the media was covering it and making it more of a hysteria than it really is. They believed that it was giving off false information and the flu was a bigger thing to be worried about. I remember distinctly that so many people were joking about it and didn't think that it was going to have such a big impact on our world as it did. The nurses didn't really care. They didn't think anything about it. Since scientists were still discovering it, we weren't sure what was fact or what was fiction. All we know was that it was targeting older people. Younger people didn't need to worry. There wasn't a treatment for it or a vaccine. And that didn't seem to scare anybody at first. They just thought it was a hoax and nothing to even really needed to be worried about or concerned with. But right when the second case was made aware of in Shelby County, it's like things changed overnight. That's when I remember seeing a response plan actually being made. Both the chief and fire police came in to make sure that our isolation rooms were set up correctly, that we had red tape on certain parts of the floor to make sure that's only where people that came in with symptoms were allowed to go. You had to make sure that you were wearing a mask and PPE wear. You had to make sure you were putting it on right, disposing it right. You had to have tests to make sure that you were doing it right, and that we weren't only using hand sanitizers, but actually washing our hands and wiping everything down that we touched. If anybody so much came in with a fever, they were put in an isolation room. Even if they had a little bit of a cough, they were also put in an isolation room. This is when I really saw a big change in the people that I was working with. They seemed a little more scared of what was going to happen, of the unknown. They weren't sure if we were going to be able to handle the curve. They even talked about opening up the second floor, which is a storage floor at the hospital, and making it just a COVID-19 floor. These patients were being sent home. They were finding places for dialysis patients to go, for hospice patients to go, to make room. That this is, I feel like, when the hospital knew that this is going to be something huge and that we needed to do something for it. And then the shutdowns came. Right as the shutdowns came, they told all of us interns and personnel that didn't need to be there that we weren't allowed in the hospital anymore and that we would have to go home. I think that's when it really hit that this was a lot scarier than what I previously thought and what the nurses and doctors were previously telling us. I think this is when it really changed in everybody's mind. Intro to Public Health. Public health promotes and protects the health of people and the communities where they live, work, and socialize. Public health also makes sure core values are given to all. By the core values, I mean whether you're rich or poor, that you get the same quality of care, that this care is made affordable to you and is accessible to you, that you are not discriminated against, and that you are able to get the same treatment as the next person. These things are very important when it comes to the COVID-19 because this virus doesn't care if you're old or young, it attacks you all. It doesn't care if you're rich, poor, or a celebrity, it still attacks you all. By public health, we are able to learn more about it. The coronavirus, we were able to get it out to the public and tell them what they need to know to help to prevent the spread of it. To help make sure that we can avoid anything that we can avoid to get this disease out, to make sure that it's gone faster than it needs to be. Public health can also help us to maintain our regular health during this time with all the government shutdowns and being quarantined to our house. It is very important during this pandemic. Epidemiology. Epidemiology is the study of the pattern and cause of health-related diseases in specified populations. Epidemiology helps us to understand how the virus spreads, who is at risk, and why social distancing is really important. Through epidemiology, we're able to learn a lot about the coronavirus and how it affects one another, from the different ages to how it's spread through touch, saliva, sweat, and how we can prevent it and get the disease knocked out, or at least make it to lower the curve in the healthcare field. Through epidemiology, we are also able to give more to the public to help them to understand how serious this virus is and how it needs to be taken and the action that needs to be taken to cut down the spread of the disease and how to lower the curve so we're not like Italy and up top and losing so many people at the time and having to decide who has to die first because we don't have enough equipment and nurses and doctors to go around for all. Project management. Project management provides a clear vision of the team's goals and the specific needs of the project while also listing the constraints. It helps us to give better care to our patients by assessing what the hospital needs and how we can do this. It helps us to increase our productivity by seeing ways that we can do things faster and that we can do things better so everybody is not so struggling and not so set off. It also helps us to manage our risk and the cost that the virus is costing the hospitals, our government, and our daily lives. Counseling. Counseling is basically assistance and guidance through difficult personal, social, and or psychological matters. It doesn't always have to be difficult. Sometimes a counselor is just to help to, just good to have to help your mental health and help you stay healthy, help you give that person outlet to talk to. Especially now in our day and age when mental health is starting to become looked on, when it's starting to really become studied and we see how important it is. Through the COVID-19, our lives have changed drastically. A lot of us have lost our jobs. We're quarantined to our houses. Our kids are not in school anymore. We have a lot going on to us. At first it's really good. We're stuck in the house with our family. But then it gets kind of scary because you have the financial struggle. We have people that are fearing of leaving their houses because they're scared they're going to get sick. We have the death of so many around us, whether it's a loved one, a friend, or just hearing the death toll go up every day, not only in our state, but as our world as a whole. I feel like counseling is very important during this time and in this pandemic. I think it can help any person, give being able to talk to somebody, it gives them a peace of mind and helps them to understand that everything's going to be okay, that we are all going to go get through this, and that they're not the only one going through this, that we can lean on each other during these times. I think it is very important for us to have a person during this to talk to get our fears out, and just to give a hug. Especially now when we have to social distance ourselves. We can't even go see people that don't live in our house. We can't go see our loved ones that are having babies or at the hospital, or our loved ones that are at their nursing homes. We can't even be in the room with, if we have a loved one catches the virus, we can't be there with them and to hold their hand. So I think counseling is a very big and huge part of this pandemic, and it's going to change a lot. I feel like it's very important for anybody that's out there to get a counselor or get somebody that can help you. I think that would be very, beneficial to right now to our mental health and to our health as a whole. Needs assessment and evaluation. Needs assessment and evaluation shows us that what we need while we're in this pandemic, and evaluation shows us how we are doing in an ongoing project. It helps us to monitor and protect our assets. It helps us to understand the training and support to the frontline workers, what they need. It helps us to see how we can get supplies out faster and more efficiently. And then evaluation helps us to see, are these changing, making an impact? Can we tell a difference? Is it really changing the way we look at the virus and the way we deal with the pandemic? Is it helping the hospital stay out of the low, making sure that the curve is not too high for them? Is it making sure that they have the correct PPE that they need to wear? Needs assessment and evaluation is another very important aspect right now during this pandemic. It really helps us to measure and see our results, and to see where we could do better and be more efficient on, and to really knock out this virus, or at least lower the curve, and find a way to, so we don't have to social distance for so long, that we can get back to our normal regular lives. I hope you enjoyed my PowerPoint on my experiences through my internship at the Baptist ER with the onset of the pandemic, the COVID-19. And I hope you all stay safe and remember to wash your hands.